Diabetes. Diabetes is a condition that happens when your blood sugar, glucose, is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly. Diabetes affects people of all ages. Most forms of diabetes are chronic, lifelong, and all forms are manageable with medications and/or lifestyle changes. What are the types of diabetes? There are several types of diabetes. The most common forms include type 1 diabetes. This type is an autoimmune disease in which your immune system attacks and destroys insulin-producing cells in your pancreas for unknown reasons. Up to 10% of people who have diabetes have type 1. It's usually diagnosed in children and young adults, but it can develop at any age. Type 2 diabetes. With this type, your body doesn't make enough insulin and/or your body's cells don't respond normally to the insulin resistance. This is the most common type of diabetes. It mainly affects adults, but children can have it as well. Gestational diabetes. This type develops in some people during pregnancy. Gestational diabetes usually goes away after pregnancy. However, if you have gestational diabetes, you're at a higher risk of developing type 2 diabetes later in life. What are the symptoms of diabetes? Symptoms of diabetes include increased thirst, polydipsia, and dry mouth, frequent urination, fatigue, blurred vision, unexplained weight loss, numbness or tingling in your hands or feet, slow healing sores or cuts, frequent skin and/or vaginal yeast infections. It's important to talk to your healthcare provider if you or your child has these symptoms. What causes diabetes? Too much glucose circulating in your bloodstream causes diabetes, regardless of the type. However, the reason why your blood glucose levels are high differs depending on the type of diabetes. Causes of diabetes include insulin resistance, autoimmune disease, hormonal imbalances, pancreatic damage. Genetic mutations and long-term use of certain medications can also lead to type 2 diabetes, including HIV/AIDS medications and corticosteroids. How is diabetes diagnosed? Healthcare providers diagnose diabetes by checking your glucose level in a blood test. 3 tests can measure your blood glucose level: fasting blood glucose test. For this test, you don't eat or drink anything except water, fast, for at least 8 hours before the test. As food can greatly affect blood sugar, this test allows your provider to see your baseline blood sugar. Random blood glucose test. Random means that you can get this test at any time, regardless of if you've fasted. A1C. This test, also called HbA1c or glycated hemoglobin test, provides your average blood glucose level over the past 2 to 3 months. How is diabetes managed? Diabetes is a complex condition, so its management involves several strategies. In addition, diabetes affects everyone differently, so management plans are highly individualized. The 4 main aspects of managing diabetes include blood sugar monitoring. Monitoring your blood sugar, glucose, is key to determining how well your current treatment plan is working. Oral diabetes medications. Oral diabetes medications, taken by mouth, help manage blood sugar levels in people who have diabetes but still produce some insulin, mainly people with type 2 diabetes and prediabetes. Insulin. People with type 1 diabetes need to inject synthetic insulin to live and manage diabetes. Diet. Meal planning and choosing a healthy diet for you are key aspects of diabetes management, as food greatly impacts blood sugar. Exercise. Physical activity increases insulin sensitivity and helps reduce insulin resistance. So regular exercise is an important part of management for all people with diabetes. Due to the increased risk for heart disease, it's also important to maintain a healthy weight, blood pressure, cholesterol. Prevention. How can I prevent diabetes? You can't prevent autoimmune and genetic forms of diabetes, but there are some steps you can take to lower your risk for developing prediabetes, type 2 diabetes, and gestational diabetes, including eat a healthy diet, such as the Mediterranean diet. Get physically active. Aim for 30 minutes a day, at least 5 days a week. Work to achieve a weight that's healthy for you. Manage your stress. Limit alcohol intake. Get adequate sleep, typically 7 to 9 hours, and seek treatment for sleep disorders. Quit smoking. Take medications as directed by your healthcare provider to manage existing risk factors for heart disease.